Hey, Joe 508, how are you? Today is the 17th, and so I'd like to give you at least a day to consume where you've left off and where you're going. Okay, so um, again, we have this in student view, so this is what you will be looking at, and you guys did a great job looking at neuroimmunology. This is super important stuff because I'm sure we've all experienced the effect of stress and how we seem to be more vulnerable to infectious diseases, cold and flus and things like that. And, uh, and then, in terms of your guys' practice, this whole concept of sociality and quality of relationships and how important that is in terms of modulating every system we've talked about it, reducing stress, improving uh, your overall physiology so you're at lower risk for diabetes, heart disease, and all the trajectories of those diseases, and then improving immune function as well. So I envision when you guys do your marketing pamphlets for your future corporations that you'll be considering these things. Okay. Now we're continuing on in our journey into interventions. And so we come over here, okay, and we find that we are now going to be getting into music therapy and exercise, okay, both amazing modalities of intervention, okay. So when we get in here into the music therapy area, I do want to give a nod to Alison Balbag, who also teaches this course and who has done amazing things in terms of her achievements in music, and she teaches a lot about the music as a form of intervention. Okay, so these are the three papers. This one is an overall overview of the many different types of studies that have looked at the effect that music has on your brain function, and as a result, the mind to body connection. Um, really good article. Again, I provide these so that you guys know that science is going to be backing your viewpoint now in life in terms of how you're going to be dealing with your clients. Okay, so this particular article gets into this concept of prefrontal cortex and the amygdala and the hippocampus and this how they the triad of these three and how they modulate our overall response to very stressful conditions. Okay, and then how music gets in there and affects them and reduces the stress response. Okay, so that's what that's all about. Okay, this article right here actually will then get in as a study, and I know it's really deep and thick in terms of methods, but I provide it out there so that you can now say, hey, the science backs what we're doing. Okay, so I'm going to be sending a separate video from the JOVE. It's an actual video experimentation video, so you can see how you would conduct a study. And the kind of things that they do in this study is they would look at your salivary cortisol, because when you're stressed out, you not only release cortisol into your blood, but you release it into your saliva. So it's a much easier way to do a study than just sticking a needle in somebody's arm like Robert Sapolsky did in the original Portrait of a Killer video when he was looking at his baboons out in Africa. And then, so that's a measure of the hypothalamic pituitary adrenal axis. Again, that's driven by the amygdala under stress. And then you can also sample alpha amylase, and it's a secretion into your saliva that is modulated by this other aspect, the more fast-acting aspect of our stress system. And this is the kind of adrenaline rush, okay? So we actually have direct wiring from the hypothalamus, it's not hormonal, that goes straight out to our salivary glands. And we've heard about the sympathetic nervous system, this part of our autonomic nervous system. So this sympathetic nervous system will differentially activate your salivary glands and change the secretion of your saliva and thus the alpha amylase. And this is why this is used as a readout, okay? I'm sure you've done this many times, you explained this many times, we had to go give a presentation in front of class and suddenly your saliva stops being secreted and you get that cotton mouth effect, okay? And again, that's stress being mediated through the sympathetic nervous system and the local release of adrenaline into your salivary glands. Okay, so this is what this paper is all about. And it gives you all the background, and I'm not going to read this paper for you. Just take your time. Don't get too hung up on the methods, okay? So this is the salivary cortisol. This is your salivary alpha amylase, okay? And again, you see right here that the alpha amylase is an enzyme that is considered to be a biomarker of your autonomic nervous system, okay? Like I said, the stress response to that, okay? Cortisol is a biomarker of the hypothalamic pituitary adrenal axis, okay? So that's what you're doing. You also do a behavioral analysis that lists the level of stress you're experiencing psychologically, all right? So you get that readout, and then you come all the way down here and you look into the actual study, okay? And they talk about different types of music listening under different conditions, okay? So that's what that's all about, all right? And how the music differentially affects those readouts of stress, okay? This right here, okay, is a really great overview of the different effects on the brain. Now, it goes beyond the things that we've talked about, okay? So it does talk about pleasure and dopamine, okay, and opioids. And then it gets into the cortisol system that we've talked about. And then it goes into the other things right here. The reason this serotonin part is important, okay, is this is our target of traditional antidepressant medication, okay? So when somebody is given Prozac or Zoloft, it's a selective serotonin reuptake inhibitor. And what that does is it elevates brain serotonin, and that in turn will impact your prefrontal cortex and how you're going to filter your view of stress, okay, your emotional filter, okay? And so whether it be pharmacological treatment of your stress or cognitive behavioral therapy, it's all about increase in serotonin's release, which then impacts your emotional filter and how you're able to deal better with stress, okay? Low serotonin, you do worse. So music elevates serotonin, and that's what this is all about right here. And lastly, right here, oxytocin. This is the social affiliation. We heard about this in the last segment, okay? This is our oxytocin to dopamine. It in turn enhances our feeling of being socially connected, okay? And what it does is it reduces the amygdala activity, so you reduce stress in that way. So it's a really great article. Again, there's a lot in here, so you just sift through it and find out what you can. Here's the dopamine basis of reward, and that's what music is. It's very rewarding, okay? This tells you the types of studies that were done, okay? So it's a review article. This is your behavioral evaluation, kind of like the other video I'm going to be sending you about how to evaluate the impact of music. And then this goes over the whole stress system that we've talked about, okay? And so this will be fight or flight, HPA, okay? Cardiovascular, epinephrine, which is also adrenaline, all things that you're familiar with now, okay? It's amazing. And then these are some results. Again, when we looked at the effect of music on surgery patients, you see cortisol levels going down, 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 down. So a pretty positive effect on many, many different things right here, okay? Alrighty. And you can see all the different types of biological markers that they've looked at there that I'm not going to get into, okay? And using relaxing music during stressful tasks, okay? what the outcome was there, okay? The mechanism of action, okay? We learn about here the autonomic nervous system, okay? Releasing adrenaline, okay? And so you reduce that, okay? Um, and then here's a little nod to our immune system. And in this article, they do look at what music did. And again, the benefits of music and laughter and stuff like that, okay? All righty. Here's a little report on social affiliation. Okay, so you now can say that you are providing these resources at your centers to your clients, and you have this sound science as outlined in this article that backs it up. And that's the whole point of this. Okay, awesome, guys. All right, so that's a really good article. This Chandra and Levitin article. Okay. These are studies right here that show you how to use this methodology, and I'm not going to go into it. I'm sending this video to you separately in case you're having trouble accessing it. Okay? All righty. Okay, so then we go from there and we go into the participation. Okay, and we're asking you to evaluate music. Okay, so we talk about, like I said right here, I give you the background that I've been talking about. Okay, right here, oxytocin, ACTH, and then this is the prompt. Okay, what happens to the brain with music? How does music reduce stress? Okay, and then I want you to kind of free associate how you're going to use this in your own practice. Okay. All righty, awesome. Okay, so then we come back here to the readings, okay, and we look at exercise. All righty, and we're scrolling down, and there's the exercise, okay. So this right here is the article that you can download, the PDF, and then this is the URL if you were to look at it. And then you look at the effects of yoga, and you finish up with this great short video from Thompson that looks at the exercise stress in the brain and the benefits that we see there. So this will give you a real sound background on this. Again, so you guys can really be have talking points for a very, very sound, informed kind of base of cognition or base of knowledge is what I meant to say that you now have to impart to your clients. Okay, this is really cool. This article, it compares yoga with exercise, and in many ways, yoga is beneficial to exercise, and that's what it was one of the first articles that did this combination thing. So it's really, really important to consider that because of beyond the exercise aspects that yoga offers, which is huge, there's a more kind of cognitive behavioral therapy aspect that yoga offers that seems to be potentially beneficial over many, many indices of our health beyond exercise. Okay, alrighty. This is a review of the effect exercise has on many brain areas. Okay, it goes over again the systems that we've been talking about. Okay, and here we see the hypothalamic pituitary axis again. Talking about corticotropin releasing hormone, all the things that you guys are now very familiar with. Okay, this basal ganglia part is really, really important because exercise has been very, very super important for slowing the progression and actually reversing trends that happen in Parkinson's disease. So definitely look at this. This is actually studies that I used to do with many of my associates here at USC. And these are the many different readouts. Okay, this goes beyond what we've focused on, but you can see all the biological readouts that you have here. This is growth factor and the antioxidants in the basal ganglia right here. That's what that's talking about. NRIT. And okay, so again, a really great review article. I do want to go back to the yoga article. It does one kind of nice kind of chart that reviews everything. Okay, and here's the benefits of yoga right here. And if you, again, the basis is a comparison, but this chart begins with stress, which you guys are now all experts in. Remember, if you're going to look at salivary alpha amylase, that's a readout of cottonmouth that is happening right here. but it also causes an increase in heart rate, okay, well, that in contractile state of the heart that causes blood pressure increases. It increases clotting by viscosity. None of these are great things. And then we come over here through the cortisol system, okay? And this HPA axis through cortisol increases blood glucose, insulin resistance, okay? Causes dyslipidemia, high blood cholesterol, okay? High LDL, causes immune suppression, causes depression, clinical depression. We see this inflammatory state that we've talked about, okay? I'm sure some of you know somebody that's taken what are called ACE inhibitors to control their blood pressure, and this also increases the activation of the system, and that's why you take an ACE inhibitor, all leading to disease. So this is a really neat figure that conceptualizes everything. Okay, alrighty guys, and we get into the exercise discussion, okay? We just, again, ask you to go through all of these things, okay? So I look forward to this. This is, again, my one video for the 2 weeks. I'm going to send a separate video for you guys to look at that Jove article, just so you would understand how a scientific study is conducted in case you need to see that. All righty, so we'll see you next week.